Because the reality of these reforms is that they're hugely ideologically based and they're not going to go away. So there are three possible outcomes. The first is meltdown. The GP consortia are going to be naff. They'll be small, they'll be powerless to shift the provider monopolies. They'll find that they can't control their budgets and the spend will go completely frantic and the Treasury will lose confidence. They'll not deliver integration, efficiency or quality. And the Conservative coalition will discover that having dismantled the Meccano set, they're left with a pile of nuts and bolts in the run-up to the election. Now, I don't think that will happen. I think the resistance of the national health system is such that they won't let that happen. It could be that there's a degree of political realism begins to be interjected, and that, in fact, what we see is a modest shift and rebranding of the old system with the new buzzwords, so that GP consortia will look remarkably like primary care trusts, but with slightly greater clinical leadership. That the performance of the system will be de facto managed by the NHS Commissioning Board with regional offices that look remarkably like strategic health authorities, and that there would be limited and reluctant cooperation between local authorities and GP consortia. But perhaps we ought to be a bit more upbeat, because it's easy to get gloomy in these circumstances, because there are real opportunities that need to be grasped and that could shape an integrated system. We should aim for big and strong commissioning consortia with close relationships between the consortia and the local authorities. We should aim for effective commissioning for outcomes and quality and management of care pathways with strengthened service links between the local authority provided services and the NHS. We should aim for bringing the patient right to the heart of commissioning in as effective a way as possible. And also not only bringing about that integration into commissioning, but also make sure that the providers have very, very good mechanisms for engaging with their populations, and that the patient genuinely has a place at the table in decision about their own care. Mrs. Thatcher was never my favourite human being, but she did have a remarkable acronym that she invented once, which was TINA, there is no alternative. And I think we're in a TINA spot at the moment, to be honest. There will be no alternative. We are going to get the coalition changes, and we really do need to work with the leverage points, which in my view are very much working with the GP consortia and working with the local authorities at a local basis to achieve this. The current Home Secretary used to be the Health Secretary in a previous Conservative incarnation. And I remember when I worked in his office, him muttering to me one day, "Thank God these levers we pull aren't attached to anything." I think the reality of being able to pull national levers in the National Health Service will increasingly go, and we'll have to all get much smarter at how we pull the local levers. So the name of the game is 1,000 flowers blooming in a cold climate. Get the fertilizer out and warm the greenhouse. Thank you.